Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today we're excited to turn over the podcast to the students from St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy in St. Louis. We give credit to Professors Stephanie Lucas and Taylor Hollick for mentoring these students with our leadership podcast. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions as shared today are those of the hosts and our guests, are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis.
Hi, my name is Carly. I'm going to be talking about infectious disease pharmacy.
Hi there, my name's Reagan. I'm going to be talking about cosmetic pharmacy.
Hi, my name's Hussein, and I'm going to be talking about geriatric pharmacy.
Hi, my name is Simon. I'm going to talk about ambulatory care pharmacy.
Hi, my name's Corey. I'm going to be talking about military pharmacy, and all of us are from St. Louis College of Pharmacy in St. Louis, Missouri. Today we're going to be talking about Can a Pharmacist Do That? From Beyond the Counter, uncovering the real impact of pharmacists in healthcare. First up, we will hear from Suman.
Before we start, I'd like to ask one question. Did you know that some pharmacists can actually run their own clinics? Most people, when they think of a pharmacist, imagine someone behind the counter at the drugstore. But there is more to the story. Ambulatory care pharmacists. Their work is a lot what doctors or nurses do in the clinic. Instead of counting pills, these pharmacists sit in the clinic rooms and talk directly with patients. Many of these patients are managing chronic conditions like diabetes, high blood pressure, and high cholesterol. One of the most important things ambulatory care pharmacists do is adjust medications. For example, they can fine-tune insulin doses to keep blood sugars under control. And they don't do this alone. They work closely with doctors and other prescribers to make sure treatment is safe and effective. They can also order lab tests, check the results, and track whether treatments are working. If the patient's cholesterol stays high, they can quickly step in and adjust the plan before things get worse. They also play a role in prevention, giving flu shots, pneumonia vaccines, and even simple advice on lifestyle changes that can make a big difference. But what really makes their role special is the long-term connection with patients. These pharmacists often see the same people over months or even years. Their relationship builds trust, celebrates progress, and helps patients stay motivated. Here's the bottom line. By keeping patients healthier and on track, ambulatory care pharmacists help prevent unnecessary ER visits and hospital stays. That not only saves the healthcare system money, but also makes patients' life easier and healthier. So next time you think of a pharmacist, don't just picture the corner drugstore. Think about clinic-based pharmacists who are making a direct, ongoing difference in patients' life.
Next up, we'll be hearing from Hussein.
Have you ever watched your grandparents open a cabinet full of medications and thought, how do they keep all that straight? Or wondered, who makes sure every pill they take is safe and truly helping them? That's where geriatric pharmacists come in. The medication experts who help older adults live longer, healthier, and more independent lives. Over the summer, I worked at an independent pharmacy and saw how pharmacists make a real difference every day, especially for our older patients. As we age, our bodies change, and the way medicines work inside us change too. Many older adults take 5, 10, or even more prescriptions each day. That's called polypharmacy, and it can increase the risk of side effects, confusion, and even hospital visits. Geriatric pharmacists review all those medications to make sure each one is safe and necessary. They work with physicians, nurses, and families to simplify medication lists and reduce risks. For example, if 2 blood pressure medications overlap, a pharmacist might suggest adjusting the dose to prevent dizziness or falls. What really makes geriatric pharmacists stand out is their focus on personalized care. They tailor every plan to the individual, making sure medications fit the person's lifestyle, health goals, and even eating habits. They don't just fill prescriptions. They educate, advocate, and listen. Their mission is to help older adults stay safe, independent, and empowered to manage their own health. Think about your grandparents, an older neighbor, or someone you love who takes several medications each day. That can be confusing, and one small mistake could be serious. Did you know that while older adults make up less than 20% of the population, they account for nearly 40% of all prescriptions filled in the US? That's a huge responsibility. And geriatric pharmacists are on the front lines keeping those patients safe. So the next time you stop by your local pharmacy, remember, pharmacists are more than medication experts. They're part of your healthcare team, working side by side with physicians to keep you and your loved ones safe. And if anyone ever asks, can a pharmacist really do that? The answer is absolutely yes. Because here at St. Louis College of Pharmacy, we believe pharmacists don't fill prescriptions, we fill lives with care, compassion, and expertise. Pharmacists, improving lives one patient at a time.
Next up, we'll be hearing from Reagan.
Thank you so much. So I'll be talking about what is called cosmetics pharmacy, also known as cosmeceuticals. And just to let you know, have you ever wondered how products like your skincare lotions and creams are created? There was probably a pharmacist involved. Pharmacists who deal with the creation and safety of skincare and other cosmetic products work in cosmeceuticals, or cosmetic pharmacy. After getting their pharmacy degrees, some pharmacists go on to work in what is known as industry, after specialized training. Industry has a large reach, including things like research, safety monitoring, and of course, cosmetics. Some examples of industry are organizations like L'Oreal and Estee Lauder that handle jobs like making all products within a certain standard and creating a baseline for safety and quality for skincare and makeup products. Pharmacists are also able to become experts in all things skin. They have the ability to make recommendations on what would work best for your skin type and educate patients on the best and most useful choice for them. For example, products would be different for someone who has more oily skin instead of a dry, and a cosmetic pharmacist would be able to help with guiding you in the right direction of which product would work best. If you've ever tried applying a product not best suited for your skin type or got frustrated by the overwhelming amount of options in skincare, I'm sure you would agree that there is a need for someone who is able to guide people and create excitement for the right products. Education is an incredibly important part of any pharmacist's day, and being able to help educate and assist people to find the perfect fit for them is always rewarding. Another interesting part of the cosmetic pharmacist job is compounding those creams and lotions. Compounding is the process of creating a medication or cosmetic from raw ingredients and providing them to patients or customers. This is often done if there is something that causes an allergy in the medication that is pre-made, or there is a special formula that must be followed. Often, the cosmetic pharmacists that are working on skincare in big companies will create compounds on large scales to make sure everything is within standard and as identical as possible. But if there is some skincare cream or lotion that contains a medication and is specialized, it is often made in compounding pharmacy, which is where being a compounding pharmacist and a cosmetic pharmacist would cross paths. Cosmetic pharmacy is slowly gaining popularity, but I hope by telling you a little bit more about their day-to-day that there becomes more of an interest in it, as there is so much good that it could do. Being comfortable and confident in your own skin is one of the best feelings, and being able to give that feeling to someone who might be struggling should be celebrated more. Pharmacists have a wide variety of careers, as we are going to highlight some here in our podcast, and do many different things. So the next time you think to yourself, can a pharmacist really do that? The answer is probably a yes.
Now let's hear from Corey. While my co-host talked about a few different career paths you could take as a pharmacist, today I'm going to talk about one that most people don't ever think about. That is the military or VA pharmacy. One thing people often think about when they hear military is boot camp. But guess what? For this career path, no boot camp is required. In general, a person can become a pharmacist in the military or the VA in one of two ways. You can either just apply to become a federal government employee, or you can join the military during or after your school. Today we'll be focused on more of the federal employee side instead of joining the military. In both cases, you have the unique opportunity to travel to many different locations, such as Germany, South Korea, Japan. The list goes on, just depending on what branch you join or what job you apply for. There are many styles of pharmacists as well. You will be able to work in hospitals, outpatient clinics, or other doctor offices in the TRICARE network. So there's more options than just commercial pharmacy. There's a wide range of job duties that you may be tasked with, such as verifying prescriptions, filling prescriptions, verifying the medication, or counseling patients. But unlike most community pharmacists, some VA pharmacists are actually able to write their own prescriptions for the veterans. This happens by the doctor diagnosing the patient and then telling the pharmacist. Then the pharmacist is able to use the patient's medical history, knowledge that they gained in school to actually decide what is best course of action for that patient. Some other duties that you may have to perform would be clerical work or even healthcare. Some advantages versus community pharmacy would be that there's a lower volume of patients, which means you can spend more time with the patients and gain a better relationship for long-term care. Since there's a wide range of duties to be performed, that also gives you a chance to sit down and rest your feet while you're doing something like telehealth or other things, which does not happen very often in community pharmacy. So if someone asks, can a pharmacist do that? The answer is probably yes. Last but not least, we'll be hearing from Carly.
Hi, my name is Carly Schusler, and today I'm going to talk about infectious disease pharmacy. You may be wondering, why do infectious diseases specifically need a pharmacist? But just as there are pharmacists who specialize in diabetes or cardiology, there are ones who specialize in infectious disease. There are 4 areas in which ID pharmacists practice: inpatient clinical infectious disease, outpatient clinical infectious disease, antimicrobial stewardship, and academic. Inpatient and outpatient ID pharmacists are focused on using their expertise in medications to guide treatment in patients. Inpatient is typically more focused on hospitalized patients who have more complex or severe infections, so their role is really in optimizing IV antibiotics. So that would include dosing, managing side effects, changing the antibiotic if needed. But outpatient is focused on patient counseling and chronic diseases such as hepatitis C, HIV, or at-home IV antibiotics. Antimicrobial stewardship is ensuring that antibiotics are only used when necessary and appropriate to try to combat antibiotic resistance. Antibiotic resistance is when bacteria mutates to evade antibiotics, which makes them useless for treatment. The pharmacist's role here is to help manage programs or create protocols to achieve this goal within the healthcare system. Academic ID pharmacists often still work in patient care as well. Typically could be in inpatient or outpatient, but they also have a role in research or educating pharmacy students. Depending on which role you take on, there's a variety of job responsibilities you'll have, but the job is always still focused around patient care. Something that I found interesting about infectious disease pharmacy is how individualized it is. Not only are you looking at the patient as an individual, but you have to consider the microbe as well to pick the best medication. So what that means is you're picking if it's a virus, bacteria, fungal infection, and then based on that, picking the right medication for that specific patient. This added factor makes each case unique and complex. One thing that's different from other fields of pharmacy is that you can actually become board certified as an infectious disease pharmacist, although it's not required. To do this, you typically have to do a residency in infectious disease, an infectious disease fellowship, or have clinical practice experience or a postgraduate residency. There is a growing need for infectious disease pharmacists due to antibiotic resistance. With less development of new antibiotics happening, ID pharmacists are needed to make the most of the medications that we already have and to keep them effective for as long as possible. So if someone asks, can a pharmacist do that? The answer is absolutely yes.
And now, to introduce one of our 2 interviewees, we have Dr. Ryan Minster, who is a faculty member of the St. Louis College of Pharmacy and currently serves as a course coordinator for our infectious disease course. He also has a background in working as a clinical pharmacist with the Veterans Association, also known as the VA, and is one of the hosts of the Society of Infectious Disease Pharmacists podcast, which is known as Breakpoints.
Well, hi, Dr. Munster. My name is Hussein Mirza. I'm a P2 student, and this is Corey Ross. He's also a P2 student. We just have a couple of questions for you to ask. What made you choose pharmacy as a career?
My grandmother had worked as a purchaser for the pharmacy in the hospital pharmacy in the town where I grew up, which is Granite City, Illinois. And our family had some knowledge, personal relationships with people in the pharmacy. I job shadowed at that pharmacy. And as I learned more about it, really decided that that was probably a really good career path to take. And actually, I ultimately wound up working at that pharmacy as a student pharmacist just about my whole time through pharmacy school. And I even worked as a PRN pharmacist there up until about 2012.
Yeah, that's really inspiring how, you connected science and, patient care. Option we have is, what does a typical day in your role look like?
Every day is a little bit different, so I will give you the skeleton of what a typical day looks like. I almost always start at the VA hospital where my practice is. I practice in infectious diseases. Every day when I go in, I have antimicrobial stewardship responsibilities. I review antibiotic orders for all the patients in the hospital, and then we also review some outpatient antibiotic prescriptions looking for perhaps some inconsistencies in dosing, other ways to optimize that therapy. We have something that's called bug-drug mismatch reports that we run. So we get an error report if somebody's on an antibiotic that doesn't match up with the organism that their culture grew. Those are things I do in the morning. And then I round with our infectious diseases consult team, our inpatient consult team. We usually round about between 10 and 11 in the morning, sit down with the physicians on the team, and then we go around and we see all of our patients on service. Typically then, not every day, but my afternoon, I might come back over here to the College of Pharmacy, teach, committee meetings, do some other things over here. That will happen sometimes. And during times when I don't have other things to do over here, I still stay at the VA and do other work in the afternoon. I am one of our pharmacy representatives on our antimicrobial stewardship committee. I help direct what the committee does, and I help do medication utilization reviews for the committees. And then also I do research at the VA. When possible, I try to work in the afternoons on finishing up research projects. And then that is a typical day for me, but I'm also a residency program director. I have a PGY2 postgraduate year 2 infectious diseases specialty resident that I serve as a program director for. And all the things I said I do, a lot of the time I have the resident with me and they're doing those things. And I'm managing their learning experience. So that allows us to do topic discussions in the afternoon and other activities with the resident, prepping them for their research, projects, presentations. And then another layer on that is I almost always have APPE or P4 students with me, and I integrate them at all levels of our practice too.
Okay, that's great. Yeah. Wow, it sounds like your role is both dynamic and rewarding.
It is. It's pretty busy. Keeps me out of trouble, gives me a lot of stuff to do.
Yeah. Next question we have is what made you choose the career path over others?
This is a good question too. When I came into pharmacy school, I thought I wanted to do pediatric clinical pharmacy. I'm about as far away from that as you can get right now when like the oldest or the youngest patient I ever see is probably about 50 on service at the VA. That evolved over time. And what happened was I was just really open to a lot of different experiences that I had as I was a pharmacy student here. And mentors are really the key to that for me. Mentors, and then realizing what I was good at when I was in pharmacy school. So the things I enjoyed the most and was the best at were antibiotics and less so microbiology, but I loved the antibiotic section of pharmacology. And then when I was going through the courses, it was called therapeutics. Those were great. And big time mentors for me were Dr. Dave Ritchie, who is still a clinical pharmacy specialist in infectious diseases at Barnes Jewish Hospital, and he was on faculty here for a really long time. I was lucky enough to have a rotation with Dave when I was a student, and he talked to us every day, as every preceptor does, but he went above and beyond. He ate lunch with us every single day. We could ask him questions and just learn much more about what he was doing. And that really solidified for me, that rotational experience, that I wanted to specialize in infectious diseases and really use what I knew from my time in pharmacy school and rotations, what I was the best at, and help patients out in that way. So knowledge of what I was doing well and what I enjoyed, but then also finding good mentors to help and guide me.
Yeah, great. That's an amazing accomplishment. You're clearly making a difference in both education and patient care.
Thanks.
Next question we have is, what do you enjoy most about being a pharmacist?
Definitely helping people, patients especially, and in this role in particular as a shared clinical faculty member, I get to help a lot of different people. Patients obviously are, I think of everything I do as a wheel and spoke model. The patients are really at the center of it, and then everything else spindles out like the spokes of a wheel from that. Even teaching you guys, I'm a better teacher if I'm a really good clinical pharmacist. And I can tell you about things that I see and things that I do in clinical practice. But you're also another big group that we get to impact and get to help. That's really special. And then I talked about our residents as well. I get to teach and precept postgraduate year 1 residents who are just out of pharmacy school, as well as, like I said, I have my own specialty resident, so I get to teach at a really high specialty level to somebody who has a shared interest and passion for infectious diseases. So I love those different groups, students both in the classroom and on P4 rotations, and then our residents at different levels, as well as the patients.
Yeah, that's all the questions we have. Thank you so much, Dr. Minster, for sharing your story and your insights. It really shows how diverse and rewarding a career in pharmacy can really be.
You're welcome. Pleasure talking with you guys.
Thank you.
Thanks.
Our second interviewee is Dr. Justine Guyton, who is also a faculty member at Stillcop as an associate professor who assists with our heart medication courses. And she is also a practicing ambulatory care pharmacist that practices inside of a public health department here locally in St. Louis. It gives her a very interesting perspective on how public health and pharmacy can sometimes interact with the general public.
What does a typical day look like for you in this unique setting?
Yeah, so I'm an ambulatory care pharmacist, so sometimes people don't always know what that means, so I'll take a step back and kind of describe that. Basically means I work in an outpatient setting, so if you think of like a doctor's office or a clinic or some sort of a health center, that we're seeing patients on the outpatient setting, so kind of like your typical doctor's office. One of the things that ambulatory care pharmacists are responsible for doing is chronic disease state management. So very commonly in ambulatory care, pharmacists will work with patients to manage their blood pressure, diabetes, talk about smoking cessation, maybe look at their cholesterol levels, and various other things. And so we have agreements with the physicians that we work with that allow us to meet with the patient, review their medicines, interview them, and then we are allowed to, in and of ourselves, adjust their medicines so we can start and stop medicines for those reasons that the patient was referred to us. Like a typical day, I usually come in first thing in the morning and my schedule is already set. So in a typical half day right now, I'd say I have anywhere from like 4 to 8 patients maybe scheduled, so between like 8 and 12. So I'm usually running through my list really quick just to see who I have coming. If I have students with me, they will verbally present those patients out loud and kind of talk through what's going on with the patient, what medicines they're on, and what things they might have as suggestions for that patient. And then we'll start to see patients. So we'll either do that over the phone with telepharmacy calls, which honestly is a big part of my practice right now, or we'll have face-to-face visits where patients will come in. I'll usually spend about anywhere from 10 to 30 minutes with the patient, just depending on what's going on and how complex things are. Go back to my office and I'll type in a SOAP note into the medical record, and I'll kind of repeat that over and over. Other like little things that come up is just phone calls, patient questions, curbside consults. Maybe a doctor walks in and says, "Hey, how would you manage this?" Or, "Hey, do you know anything about this new drug?" And we'll answer questions and provide drug information. And then usually I'll have at least a half day a week that I have some time set aside for projects. And so that's going to be doing things like the quality improvement projects I mentioned earlier, or some kind of like bigger population health things, or sometimes I'll have chart reviews that I also do for patients.
There's like a lot of things going on.
Yeah.
So looking back, what has been your most meaningful professional experience so far in this position?
It's hard to say like one particular scenario, but kind of big picture. I find that when I first meet with patients, sometimes they are surprised at how much time I have to spend with them. So like I said 10 to 30 minutes. And so that's just kind of like directed straight care and conversations with them. So I feel like a lot of patients will express appreciation for having the time to kind of talk through things really thoroughly, to not just suggest they start a medicine, but to really stop, say, how does this medicine work? Why is it recommended for them? What side effects to expect, how we'll maybe change the dose or titrate it. And so just a lot of like positive feedback from patients that are just like, wow, that was really helpful. Thank you so much for taking time to explain things for me. And so that for me is very meaningful because, that's what I went to pharmacy school to do, is to be a drug expert. And then I get to share that knowledge with patients. So it's probably a little bit more of an answer to why I love ambulatory care.
It's great. As a pharmacy student, I also love to share those experience. And I have another question that when did you first become aware that pharmacists could work in ambulatory care clinics?
Great question. I remember being a student and faculty members talking about their practice sites, and they mentioned they worked in ambulatory care, and I just could not fathom what that meant. They said they changed prescriptions, and I was like, really? But like, isn't that what the doctor does? And I just could not put my mind around it. And so for me, what was really pivotal was P4 year, when students go on the advanced pharmacy practice experiential rotations, and you get to see what these people are talking about kind of firsthand and really observe it for a long time. And I had an ambulatory care rotation that fall of my P4 year, and I got to see all these things kind of put together, see how the pharmacist was integrated into that clinic, see how they really were writing prescriptions and changing things and using all the knowledge that they had gained in the classroom. And so that's when I first kind of really had the aha moment that like this is something that I am very interested in. So P4 year.
It's great. We heard about your meaningful experience, but I'd like to know more about the job satisfaction. Then what do you enjoy most about clinical practice?
Yeah, I have taken like some of those personality tests before, and one of my traits that comes back is learner, and I think that really relates to what I enjoy in clinical practice. I love getting to read new articles and finding out about new medicines and kind of being on top of my game and being very knowledgeable in my topic area, and then being able to apply that in clinical practice. It just is very satisfying for me. So I think just, being able to be so knowledgeable about what I know about drugs and then being able to use that directly with patients is what I really enjoy.
Mm-hmm. From your ambulatory clinical pharmacist, what are the main differences between working as a clinical pharmacy in the primary care clinic and working as a pharmacist in the more traditional setting like CVS, Walgreens, that we all know?
Yeah, this is going to be a little bit of an oversimplification, but this is how I explain it to people who maybe aren't as well versed in pharmacy. I think that your doctor of pharmacy degree does an excellent job of preparing you to be medication experts and to be very good at being part of the team and kind of helping execute medication orders. We definitely teach students how to think more clinically as a part of that process, but I think to truly be really great at it, it does take residency training, so that's postgraduate training after you finished your PharmD degree. And so I did do 2 years of extra training. I think there's a lot of diseases and drugs that we don't fully cover in the classroom, so it just gives you a lot more experiences. So big picture, I am somebody who's picking the medicine out. Nobody is double checking me. It's not getting run by anybody else. Like, that is my role. And so I do think that it's a little bit of a difference in a mindset when you're the one kind of evaluating a patient from the ground up. Is this medication appropriate or not? Versus if your role on the team is more of getting the medication to the patient, making sure it's appropriate. So kind of a double check and educating them on like what to expect with the medicine. So big picture, I would say I pick medicines for patients, which is a little bit different than filling the role of getting the medicine to the patient.
From your perspective, what impact do pharmacists working in a clinical setting have on broader community?
Yeah, so that's a great question too. I think big picture, we certainly have a lot of individuals that we help on a one-on-one basis, kind of helping them become more knowledgeable about their health and their diseases. We also are involved in some big picture things, like I mentioned, with the quality metrics and helping make sure that not just like the 1 or 2 patients I have a referral for, but most of our patients in our clinic are hitting those health goals. So that's another way that we can be helpful.
Yeah, I think that's all for this podcast question, and thank you for your time.
Yes, thank you so much for coming onto our podcast today. We really do appreciate it.
It was great being here. Thank you.
Thank you.
And that's all of our guests for today. While community pharmacy is an excellent career path, we just wanted our viewers to know that there are so many other pathways to go down with a pharmacy degree. As we've seen across today's podcast, pharmacy is not a one-size-fits-all career. Each path, whether it's geriatrics, infectious disease, ambulatory care, cosmetics, or the VA system, shows how pharmacists can specialize and impact lives in very different ways. We want you to explore beyond the obvious and see that pharmacy has many doors. Talk to professors, mentors, other professionals to discover different career paths that might excite you, and take steps now to prepare yourselves. For more information, you can look at the American Pharmacists Association's Career Pathway programs. Thank you for your time and listening to us talk about niche career paths that you could do as a pharmacist.
A big thank you, students, for hosting the Dose of Knowledge podcast as part of the Pharmacy Frontiers. And thank you to our listeners for joining us today. Please share this episode with your friends and seek out other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.